When my daughter was born, I was 17 when she was born. When she got older, I started noticing a change. She was starting to hang out with the gang. She started smoking marijuana, ditching school, and her grades were completely dropping. And that's when mom, she told me, she's like, you know what? I can't deal with her anymore. Would you take her? I was very happy. I'm like, okay, you know what? I'm finally going to have my daughter here. To me, I didn't think she had anything wrong mentally. I thought she was just, okay, she's just being a teenager. She's just being rebellious, until she started hearing the voices. I got a call from Montebello High School stating that my daughter was on the way to USC Medical Center. She was in the restroom and she sliced her wrist. When the doctor came up to talk to me, it almost seems like I was the cause of this. After that, she would draw like somebody like in an accident, bleeding. She would just not talk. She used to explode at school, and there we go, another cut, and there she goes back into another hospital. I wanted to help, but I didn't know how to even go about getting any kind of help for her. Physically, I was breaking down. Emotionally, I was breaking down. My job was put in jeopardy because I wasn't working to my full potential. I remember driving home with my oldest daughter in the car. And I started crying. I felt I was going to lose my family. I felt I was going to lose everything.
Crittenton services as a multi-service, multi-location child and family advocacy organization.
Here at Crittenton, we strive to treat the whole child and not just the label that they come with.
We don't just serve that one assigned client, we serve the entire family.
Wraparound services really offer an intensive home-based service.
The team would meet with both of us, and then my daughter had her therapist, and I had the parent partner.
We have this motto stating, doing whatever it takes.
Our team will be out there at 2 o'clock in the morning if that's what it takes.
If she had a crisis at midnight, somebody would pick up the phone.
In Hector's case, we saw improvements almost immediately.
I noticed that her mood was changing. She was happier.
She actually stopped those self-injurious behaviors.
She has to be on medication, and now, to this day, she claims she doesn't hear the voices now.
And within 6 months, the social worker had seen so much progress that they decided to close their case.
For once, we actually saw a big light in the end of the tunnel.
For many of the children, it is going to be a rocky road and not a straight line towards recovery.
A month and a half later, she ended up just falling back to her same routine. The difference this time is that I'm more knowledgeable on what's going on, so now I can read the signs better, and I can talk to her and kind of guide her through what she's going through.
Hector was really a great advocate for his daughter.
She's been hospitalized so many times. Now I basically advocated for myself. And I'm like, okay, now that I did all that I could, what can the school do? They ended up putting her in a residential school out of state. I'm actually excited to get her back soon.
Seeing Hector be empowered and really advocate for his family is priceless.
After Crittenton, I was having actually dinner with my daughter, and she's like, you know what, Dad? You were so good at helping me through this. Why don't you try to become a parent partner? About a year later, I applied to Crittenton Services, and now I'm a parent partner.
And he really takes his job seriously to help others. And he was actually just awarded Superstar of the Month.
Without Crittenton, I would have lost my daughter. She would have been pulled from me. Maybe I even would have lost the baby, and I probably would have divorced.
There's many families out there who have struggled with this, and Hector's story is only one story.
Thank you to Crittenton Services, to the team that helped us out and believed we can succeed. We couldn't do it by ourselves. We couldn't.